Welcome to our guide on medical coding for acute and chronic conditions. Let's explore how standardized coding improves diagnosis tracking and patient care. Latest Take Overview. In this video, we'll cover the basics of medical coding, the characteristics of acute and chronic conditions, coding guidelines, sequencing rules, and the use of Z codes. Let's get started. Introduction to medical coding. Medical coding translates diagnoses and treatments into standardized codes used for billing, record-keeping, and analysis. Acute conditions are sudden, short-lived, and often severe. Chronic conditions develop gradually and persist over time. Accurate coding ensures effective care and proper reimbursement. Now we go and see what are the characteristics of acute conditions. Acute conditions arise suddenly and require immediate medical attention. Examples include pneumonia, heart attack, and sprained ankle. These are coded using ICD-10-CM, acute disease codes. Coders must identify onset and severity to apply the correct codes. First, we go and see what are characteristics of chronic conditions. Chronic conditions develop over time and require ongoing care. Examples include diabetes, hypertension, and osteoarthritis. They impact quality of life and healthcare costs. Proper coding reflects long-term care needs and helps manage complications. This is the most important part for coding guidelines for acute and chronic conditions. Acute conditions use specific codes for sudden symptoms. Chronic conditions use codes for long-term issues. When chronic conditions flare up, code both the chronic condition and the acute exacerbation. Sequence acute conditions first if they're the primary reason for the visit. Now we go and see what is sequencing and Z codes. Sequencing is key. Acute conditions go first, followed by chronic ones. Z codes indicate ongoing care, such as Z79.4 for insulin use, or Z51.81 for chemotherapy. These codes help track long-term treatment and improve record accuracy. Summary and call to action. To summarize, acute conditions are coded first when urgent chronic conditions require ongoing care and additional codes. Follow sequencing guidelines for clarity and accuracy. For more information, visit official resources or contact your healthcare provider. What is basic need to confirm primary diagnosis? First, always align your OASIS ICD codes with the physician's referral documentation. This ensures accuracy and compliance with Medicare regulations. Next, select the primary diagnosis based on the main reason for home care. This should be documented by the certifying physician during the face-to-face encounter. Remember, the face-to-face encounter is crucial. It must occur within 90 days before or 30 days after the start of care and should support the patient's homebound status and need for skilled services. Lastly, ensure all diagnoses are supported by proper documentation, such as discharge summaries or physician progress reports. This helps in accurate coding and appropriate reimbursement. That's it for our quick guide on home health coding basics. Follow these guidelines to ensure compliance and effective patient care. Thanks for watching. And in next